Let's see some more important questions. A patient scheduled for a major surgery in 1 hour is very nervous and upset. Which of the following order medications would the nurse administer to relax this patient? So you need to have an anti-anxiolytic, you know. So this is a drug. Anxiolytics are the drugs which decreases the anxiety and nervousness. Okay, so a patient is scheduled for major surgery in 1 hour is very nervous and upset. Which of the following order medications would the nurse administer to relax this patient? So you should have idea about the anxiolytics, and in this pentobarbital sodium. This is the answer. So pentobarbital sodium is a drug which is used before surgery to reduce the anxiety, to reduce the nervousness, and make the patient comfortable or to relax the patient for the surgery. A patient with poor wound healing and poor appetite has an order to begin total parenteral nutrition. So the patient is having poor wound healing. Poor wound healing is an indicative of nutritional deficiency. Decreased nutrition will lead to poor wound healing. And poor appetite has an order to begin TPN. Waiting for the TPN solution to arrive the pharmacy. From the pharmacy, the nurse should take a pair of sterile gloves, infusion pump, IV tubing with microdrip, forward in iodine swabs. So usually total parenteral nutrition we give in an infusion pump. We attach the TPN to an infusion pump. So this question, when you look at the question, you should understand. This question is to assess the nurse knowledge or the candidate's knowledge of how to administer TPN. So very specifically, when you administer the TPN, you should have an infusion pump. An infusion pump, you can only administer TPN with the help of infusion pump. So that is the reason for this question. So this is a question to assess the knowledge of the candidate about how to infuse the total parenteral nutrition, whether you need an infusion pump or you do not need an infusion pump. Okay. All right. The next question. When conducting discharge teaching for patients of a child newly diagnosed with cystic fibrosis, which of the following statement by parent indicates the need for further teaching? So, cystic fibrosis is another important topic. So, cystic fibrosis is frequently repeated topic also. So, you are teaching the parent of a child for who is diagnosed. It is a newly diagnosed. So, parents will not know much about cystic fibrosis. Which of the following statement by the parent indicates the need for further teaching? Weekly weights help evaluate the effectiveness of nutritional intervention. So, weekly weights help the doctor know if my child is absorbing nutrients. Weekly weights reassure my child that recovering is progressing. Weekly weights help the doctor know if my child needs additional enzymes. So, cystic fibrosis is a condition where there is deficiency of enzymes, decreased enzymes. So, enzymes, if your options as enzymes, so this can filter more. This is more accurate than the other choices where you don't have anything about enzymes. So this is how you can filter from the choice. So cystic fibrosis is a condition where there will be deficiency of enzymes, mainly pancreatic, reproductive, and respiratory enzymes. So mucus production will be decreased. It is a the autosomal recessive disorder. It is a genetic disorder where there will be deficiency of enzymes. So since there is enzymes in this option, it goes more with cystic fibrosis. A patient with pulmonary embolus and nursing diagnosis of impaired gas exchange has an order to obtain ABG. So this is very important, especially when you have ABG or anything related with the arterial analysis. You should perform Allen's test. We have a separate PowerPoint which describes all these tests. So performing Allen's test is very important when you do a ABG. Allen's test is nothing. It is a test which is used to identify the patency of your artery. Patency of the artery. Mainly, you have two arteries in your hands. One is radial and the other one is ulnar. So, you check the patency of this radial and ulnar artery by Allen's test. So, it is very important to know Allen's test, and that is the test which we use as a first intervention before doing arterial blood gas analysis. A patient is diagnosed with pulmonary hypertension. Which of the following nursing diagnosis should be priority nursing diagnosis? So, this is about the priority. Impaired gas exchange related to altered blood flow secondary to pulmonary capillary constriction. Fatigue related to hypoxia. Anxiety related to illness and loss of control. Activity intolerance related to imbalance between oxygen supply and demand due to right and left ventricular failure. So since this is about pulmonary hypertension, so there is increased blood pressure, but the cause is from the lungs. Impaired gas exchange related to altered blood flow secondary to capillary constriction. Fatigue related to hypoxia. Anxiety related to illness and loss of control. Activity intolerance related to imbalance between oxygen supply and demand due to right hand. So usually, see why this is the most apt diagnosis among this, because right and left ventricular failure, RV and LV failure, right ventricular failure and left ventricular failure is the fact that leads to pulmonary hypertension. So this is a diagnosis which has given very effectively the rationale for activity intolerance. So this can also be considered. You can think, pulmonary hypertension. So it can be because of pulmonary capillary constriction. If you think this is also right, but what happens is that more than this, activity intolerance, see, this will be definitely there for the patient. Patient will not be able to do activity. Related to, they have written very carefully that it is because of the imbalance of oxygen supply. And the third thing they have told very clearly that because of the right and left ventricular failure. So this nursing diagnosis has everything intact. It has written the problem, activity intolerance, the reason is there, and related to why is also there. So this is most accurate. The patient who had abdominal surgery is in post anesthetic care unit. So after the surgery, the patient is in PACU. Which of the following nursing diagnosis takes the priority? So basically, anything after the surgery and when it is in the immediate post anesthetic care, you can have two. One is risk and other one is ineffective airway clearance. But this is just a risk. So this will be eliminated. Whereas ineffective airway clearance, for sure the patient immediately after the surgery will have ineffective airway clearance. And this is the priority, okay. Even we can consider acute pain, which this is also there. This can also be there, but airway clearance will be always the priority intervention because we go for CAB. So in this A comes. This is circulation, airway, and breathing. So this is the priority always. So ineffective airway clearance will always be the priority. While caring for the patient, especially they have in this question, they have said the patient is in PACU, that is post anesthetic care unit, and it is, which means it is immediately after the surgery. So you should always understand that ineffective airway clearance will come as the priority. While caring for a patient in post anesthetic care unit, a nurse observes that the onset of rapid breathing, cyanosis, and narrowing blood pressure. The nurse should plan to. So you see, there is a rapid breathing, cyanosis, and narrowing blood pressure. So immediate PACU will be suctioning the airway. Administer blood bolus glucose, no. Turn the patient, no. Administer IV, no. You can suction the airway. You don't have to wait for the doctor's order for that. You can easily do it and you can suction the airway.